first of all, we're going to look at two different instruments that are used in order to screen for mental health, okay? Why do we do that? We're the juvenile justice system. Why in the heck are we looking at mental health needs of these kids? Well, research has shown us that 2 out of 3 youth in juvenile justice settings have some kind of a mental health disorder, okay? 2 in 10 youth in the general adolescent population have some kind of a behavioral health or mental health disorder. So really, in order to get a full picture of the kids, we don't want to look just at risk and needs. We also want to look at those mental health concerns that the kids have in order to maximize the treatment for the youth. We really want to take our time and look at what's going on with this kid behaviorally with the mental health issues. We want to, first of all, avoid imminent harm to self or others. You know, sometimes kids are in our offices for very, very low-level crimes. But when they come in and you find out what's going on in their lives and, you know, the youth may have some suicide ideation going on and that kind of thing, we really want to make sure that we're dealing with those issues as well. It's kind of forget about the little shoplifting $2.98 at the store. Let's deal with what's going on in your life and why you're thinking about hurting yourself. So you kind of have to set one aside and deal with the other. The most important thing is we want to make sure that we're not doing any harm to kid. Do no harm. Okay, so if you have a kid who is experiencing some real mental health issues, you don't want to put those kids in a setting where it's really going to create more issues for them. So you do want to make sure. You want to make sure that you're seeking treatment or the youth is seeking treatment in order so that they feel better, okay, so that they aren't suffering, okay? We don't want to do that. Also, for just plain old delinquency prevention, that if we know what the mental health needs or the youth has and we're looking at those mental health needs and dealing with them, then the chances of them continuing with their delinquency behavior will increase. And then also just in documentation, okay, and keeping everything in order and keeping your case plan in mind. Generally, mental health screenings are used with every youth that comes into your program, usually at the time of intake. So again, we're talking about a screening, so you're going to screen everybody. You identify youth who might have serious mental health needs. So just because you're doing a mental health screening and the kid's scoring high in an area, it does not mean they have a mental health disorder. It's a screening. Screenings by nature pull more kids into the system than they screen out. So you always want to remember that. So don't get flustered if a kid's scoring higher and there's a warning sign and all that kind of thing. It just means there needs to be more work done, that you need to look at the situation, look at what's going on, to have this child really, to determine whether or not this child has mental health needs or not. Screenings can be early warning signs, okay, that something's going on. They can assist in deciding whether or not the kid needs to go further for an assessment or an evaluation with a clinical person. And then also you want to make sure that you're using an evidence-based mental health screening tool. And the two tools I'm going to talk about today both are evidence-based screening tools. Evidence-based screening tools means that it should be routine. Okay, we talked about this already. You want to do it with every kid that comes in your door, and it needs to be something that you can do. Okay, that you want to use an easy instrument that you can administer to the youth, every youth that comes in the door. It needs to be standardized. Okay, so you need to kind of do the same thing every time. Okay, when you change things up, then you lose your standardization. It needs to be relevant to the population you're working with. And again, we talked about this a little bit earlier, you know, that if you have to you need to look at the age of your youth and make sure that you've picked a tool that is going to be within that age range. Okay, and you need to also make sure that the tool is really measuring what it is that you want to measure. That it's valid, that there's been some research behind it that says this works with youth. And then you also want to make sure that it's youth appropriate. And by that, it's what is the reading level? Okay, is this going to make sense? How is this going to be administered? Screening tools should be used individually, not in a group. And some people think, oh, well, I can just do it during my first session, so you have the kids sit down and take a little test. Well, with the mental health screening, for the most part, they're administered individually, not necessarily in a group setting. You need to make sure that the youth and their parent are adequately informed about the process and how the information is going to be used. Okay, we talked about that a little bit earlier too. When you're doing a mental health screening on a youth, you want to let them know how what you're going to do with that information. Okay. Some screening tools have computer-assisted administration and scoring, and both of the instruments that I'm going to talk about today do have computer-assisted administration. If you are in a position, if you don't have a computer, okay, the Maisie 2 can be read to the child. The staff needs to read it. The youth needs to have a piece of paper. They don't give their answers out loud. There's a little level of confidentiality that needs to be there. Let the kids circle yes or no on the sheet, okay? So if you are using paper and pencil, that's just kind of one of the things that Brisso, who developed the Maisie 2, kind of talks about, not having the kids have to give their answer out loud. Okay. These are things, inappropriate assumptions, things that you need to think about when you're doing a mental health screening. First and foremost, it's not a diagnosis, it's only a screening. If a kid's going high, it doesn't mean they're depressed. If a kid's, it's just a screening. Screens in all youth with mental health disorders. Well, no, there's no screening tool around that's going to do that. There's going to be kids that kind of don't answer yes to the question. So, don't think just because you've done a screening the kid doesn't have a mental health disorder. There can still be some issues going on. And it screens in only youth with mental health disorders. And that's probably the bigger concern with a screening instrument, that you're pulling in more kids. Okay, you're going to get a lot of false positives. Okay. How many people use the Maisie 2? I know there are quite a few. Okay. So I'm going to go through this pretty briefly. It's very easy. It was designed in order to identify youth who are entering the juvenile justice system who may have special mental health needs. It's a self-report, 52 questions, yes or no. Talks to the kids about issues that have been going on in the last few months. It's at a 5th grade reading level. It's available in English and Spanish, and it takes about 10 to 15 minutes to administer it. So it meets those kind of qualifications that we talked about. With these 52 items, they're asking the youth if the behavior, thought, or feeling is true for you in the last 6 months. For most of the subscales, we'll talk about those, or primary scales, we'll talk about those in a moment, what they are. But for the most part, you're talking about true for you for the last 6 months. With traumatic experience, we're asking about lifetime. Is this true for you over the course of your life? There are a few items on the Maisie 2 that do not add into scoring. Okay, they're just kind of in there to kind of, it's part of the reliability of the test and the structure of the test. This is what we're looking at. We're looking at alcohol, anger, irritability, depression or anxiety, somatic complaints, looking at suicide ideation, thought disturbances for boys only, and traumatic experiences. So those are the domains within the MAISY-2. Why do you think they only have thought disturbance for boys? I always thought it was because women's thoughts are always clear and concise and never disturbed in any way. I'm not sure. The truth of it is they just haven't done the research on it to figure out what the norm is for girls. But I always thought, oh, that's kind of really very, very interesting. And I thought, oh, we're not able to have our thoughts disturbed, all right? Do you agree? Is it? Okay. Oh. All right, so, basically on this slide it tells you how many items there are, for suicide ideation, thought disturbance, and traumatic experiences. The youth goes through and answers yes or no to each of the questions. When you get to the scoring, you want to go ahead, and there's scoring instruments in there, but you want to have the youth circle the yes answers and count the number of items circled. And the way you do this is you hook up your little square circle here to your little circle there. Do you guys need me to go through this? It might be easier to show you individually, but I know a lot of people do it. But you just hook up your circles, and then whether or not it's in anger or anxiety or depression, you just circle the numbers. And then you add up the numbers in both columns, and then transfer it over to your warning or your caution or no risk. Does everybody know how to do that kind of? What? Yes. Yeah. It is available on the computer as well. The MAISY is, yes. I've never used the computerized version. I've only used the paper. You use the computer, so it gives you... Okay. What does the scoring mean? In the caution, it means the youth has scored higher than 2/3 of the youth in probation, intake, or secure pretrial detention or reception centers. So they've done a lot of research, and those kids who are scoring in the caution area are higher than 2/3 of the youth in detention populations. So that kind of says there needs to be something you need to look at. Warning, youth is scored in the top 5 to 15% of justice system youth. About 1 in 10 youth score in the warning area. And again, the testing and everything was done with kids who are locked up, not necessarily the kids that we see in the diversion program. So when you're talking about kids who are scoring in the warning sign, that kind of says, that's something you have to look into a little bit. When you folks get a kid that's scoring in a caution or a warning on the MAISY-2, what do you do with that information? I'm sorry, what? Okay. One of the things that I want to remind people about is you're going to bring in more kids into the system when you're doing screening. So one of the things that hopefully after you're doing the MAISY and you're getting, your information and you're scoring it out, that your staff are doing some follow-up questions with the kids. One of the areas that I thought of, I was doing a assessment with a youth, and he scored really high for traumatic experiences. Well, when you talk about traumatic experiences in a child's lifetime, I don't know, I kind of think of kids who have been sexually abused. I think of kids who have suffered a loss, like of a parent or someone close to them. I think of those kind of major things that are going on. So afterwards I'm going, okay, he scored high in this, So, you know, ask some general questions. You have rapport with kids. And I said, what event are you talking about? What happened in your life? Well, 2 weeks before he was with me, he fell on his bicycle and skinned his knee. It was traumatic for him at that moment. But did I really think that that was going to be a kid who really suffered from a traumatic experience and needed a mental health intervention at that point in time? No. He was hurting. His knee was skinned, okay? And it scared him, and if you had a bad little bicycle accident, it would stay with you for a while. I don't think it was going to create turmoil for him for his whole life. So regardless of, you know, what you're getting, do spend that time to talk about it with the kids and really figure out whether or not mental health treatment is needed or whether some other kind of programming is more appropriate. Okay. Any questions about the Maisie 2? I kind of went through that pretty darn quickly. And I'm going to go through this one, even it's going to be even quicker. Another mental health screening tool that is used is the Diagnostic Predictive Scale, and this is the one that we are currently using at the Juvenile Assessment Center. We did use the Maisie 2. It's an excellent instrument. Nothing against it at all. But we did, I think, probably 4 years ago, we switched over to the Diagnostic Predictive Scale. Like the Maisie 2, it's used to identify youth with a possible mental health disorder. Okay? It is a self-report, the design. It is computerized. It cannot be, it's not a paper pencil test at all. It is a computerized test only. Yes or no questions. The Maisie asked about things for the last 6 months. DPS asked about things for the last 3 months. It is available in English and Spanish. Okay, there's no reading level associated with it because the computerized version reads the question to the youth. But it's still about the words and everything. I bet if they did a reading thing, it would be about the 5th grade level. And it takes maybe 10 to 15 minutes to administer. The youth is doing it on their own on a computer. I put in this to kind of show you what a sample question is, because again, this is computerized, so I didn't have a lot of things to draw upon. But for this question, I want to know if you ever had a sudden attack of feeling very afraid. And the kind of attack, I mean someone becomes very afraid even though there is nothing around them to frighten them. I'm not going to read the whole thing, but you can see that it kind of gives a little bit of an explanation of what they're talking about. And this is, again, read to each child through the computer. After they kind of go through a little thing that kind of gears them into where we're going, then there's the questions. In the last 3 months, have you had an attack when all of a sudden you felt very afraid or strange? Have you had a time when you suddenly felt that you were suffocating or you couldn't breathe? And then do you have asthma? So these are kind of disqualifiers here, okay, because if a child has asthma, then they're going to feel that not being able to breathe thing. It's the only time you felt afraid or like you couldn't breathe when you were having an asthma attack. So trying to differentiate there between a panic attack or an asthma kind of thing. Okay. Anybody have any questions about that? I'm sorry, my allergies are so bad I can't.
Why did you guys choose to switch from the Maisie to the DPS?
Why did we choose to go to this? Well, one of the things that, I guess one of the reasons, I think again the Maisie is a great tool, but the Diagnostic Predictive Scale leads you a little closer to a possible diagnosis. Again, we're not doing a diagnosis, but we felt that it gave us more information that we could hand off to the clinical person who would be doing an evaluation, and that the results of your the DPS really looks at these different DSM-4 diagnoses, whereas the Maisie looks at anger, it looks at things more conceptually. The GPS kind of narrows it down a little bit more. So we felt that it gave us more, just a little bit more direction. That's kind of why we made the choice. This is what is assessed on the GPS. So we're looking at social phobia, agoraphobia, panic attacks, general anxiety, post-traumatic stress. Those are the different diagnoses that are there on the DPS. One of the things about the DPS too is you can turn on and off different categories. We were trained by Columbia University, and one of the things they recommended was that we get rid of conduct disorder, because just about every kid in the juvenile justice system is going to score positive for conduct disorder. Well, we chose not to do that because, again, we're talking diversion. We're talking first time in the system. We're talking kids who don't have a huge criminal history. So we wanted to leave it in there to say, okay, kids coming into a diversion, are they scoring conduct disorder? And we're not finding, actually, we're having kids score much higher in general anxiety, and post-traumatic stress disorder than we are conduct disorder. So that kind of says something. So that's a decision that you would have to make based upon your community and what you think. But we left it on, and if I was going to get rid of one of them up here, I'd get rid of the eating disorder, because it asks a couple different questions, and quite honestly, I would say I have an eating disorder, and I really don't, because I eat just anything I want to eat. And I have, but do you feel that you're overweight? Yes, I do. Has anybody ever said the questions just don't, that's the one that I probably should turn off. So I don't think it does a good job. Okay, I'm going to close out now, and I just want to mention this. Using good assessment requires, first of all, that you're using an evidence-based tool. And that's really very important, that we want to select a tool that focuses on specific mental health issues. That we want to make sure that, along with doing our assessment, that we are reviewing records. And there are times when we have more records than other times. There's no doubt about that. But you want to make sure that you're gathering as much information as you can. You want to get information from the parents, from the teachers, and others in the community. And that you also really want to work on your interviewing skills with kids. That you do want to make sure that the kids feel comfortable talking to you. You need to build that rapport. When you stop and think about what we're doing with assessments at the diversion level, at least in my office, I don't know if it's any different, but a kid's coming in, and within 15 minutes, we're asking these kids some pretty personal questions. So those first few moments that your client's spending with you, you have to really project yourself as very open, very caring, very there to help them kind of thing, so that the kid is feeling comfortable in sharing the kind of personal information that you're asking them. So you don't want to it's really important to have, use the good tools, but you also have to have that good stuff inside you that kids are willing to talk to you. Does that make sense? Okay. What's the cost on the GPS? Well, like the Maisie 2, it's free because it was, they developed it through the National Institute of Mental Health. However, there is a cost associated with the training, and I hear it can be very expensive. So you just have to talk to Columbia University and find out about that. Okay?
That was the one line in their little chart there that I didn't have any information. So that's where they would, if they just went to Columbia University or the National Institute of Mental Health,
I don't know about the National Institute of Mental Health. It's always been Columbia that I've worked with.